Kicked.
Hey, we're getting kicked all right. Here it goes. Hi, everybody. Welcome to Stages of Life radio show. It's Dr. Klein, Dr. David Klein. You know that. And we are now live on Facebook as we get ready for the show. So, good afternoon, Dr. Klein. How are you?
I am feeling pretty darn awesome. In all things considered, if I were feeling any better at all, there'd be two of me.
No.
No question.
No. Can't have that. That is not allowed. I believe the wife is like, I can only handle one of you as it is.
Well, that's probably true.
Fair enough.
Yeah, I think it's all she could. You know something? Now that you mention it.
Yeah.
She has this problem with morning nausea sometimes. So I suppose I would probably push her over the edge with that. So.
Okay.
What
are we talking about today?
Today we're going to talk about something new. Actually, it's not. Okay, I said that just to kind of hook you in. But it's going to be strategies to get back to work and, more importantly, getting back to school or even getting back to travel. Because this has become a really big part of my life. In fact, it's resulted in me not having any life at all. So my phone has been ringing off the hook from employers, individuals, other healthcare providers. You know, what do you do when? What do you do if? How do you handle this, and what are your plans? So what I'm going to do today is I'm going to spend 60 minutes going over this and making sure that everybody understands pretty well what a good plan is. You know, what does it take? What does it take to get back to school safely? What does it take to get back to work safely? What does it take to keep yourself safe, happy, and, wouldn't you know it, making a couple bucks? Because you know that extra $600 is going to run out here shortly. And when it does, don't hold your breath about it having it re-upped, because it's not going to happen. You have got to get back to work. You're not going to be able to feed yourself. And that is a sad fact, but it is what it is. So the trick here is to keeping you healthy, and that I see as my job. And it's job security, actually, now that you mention it. Or did I mention it? Someone mentioned it, as Melissa so aptly pointed out, but it wasn't me. So we're going to be on in just a second or so, and then I'm going to wow you with my clinical acumen, sense of humor, here we go. Here's where we have the canned laughter kick in.
Somebody step over. We have to make some room for his head.
Yeah, you don't have to worry too much about that. I'm having a blast. Yeah, this is fun stuff.
This is going to be a good time.
It's going to be a good day.
You're right. So much going on, so much to plan ahead for.
Well, it is. How do you travel?
Exactly.
But how do you make arrangements to go from here to, if you were dumb enough to go to New York, but let's say that you're going to go to someplace sensible like Wyoming, all right? And how do you plan around going there? Because people are going to be there taking your temperature, which, by the way, is a big joke. Okay? It is a huge joke.
I've tried to explain it to people, but nobody wants to listen. A little air gun and it's 95 degrees or 100 degrees in the shade.
It absolutely doesn't work. In fact, when we go live, why don't you ask me that question? So, one of our listeners is asking about, you can be listening for that purpose. Yeah, why is that a joke? And the answer is that when you're off the skin like that with these quote-unquote touchless thermometers, which, by the way, I went ahead and bought 2 of these. Why did I buy 2? Because I thought that one of them wouldn't work, which is true. They're out of China. And I validated against a $6,000 machine. It didn't work. They're 2 degrees low. So you have got to be some serious sick before those things will pick you up.
Oh, yeah. You remember when they came out with those little plastic strips that you put on the forehead?
Oh, those are better.
Yeah, exactly. Those are better.
Those are better. Those are liquid crystal. They'll tell you a little bit.
I could lick my finger and tell you better than those guns and put it on your forehead like Mom used to do.
No, actually,
kiss your forehead thing.
Your best bet is this, is you take the back of your hand and you put it on your kid's forehead, and if it feels hot, it probably is.
Exactly.
Yeah.
That's old school. I mean, those old wives, they knew what they were doing. I mean, witch hazel.
Well, speaking of old wives, the only cougars that chase me now are in their 90s.
Yeah, well.
Bummer. Oh, I just took a hit from my wife.
Another one. We all heard that.
She's hardly 90. So,
how long do we have there, boss?
Yeah, her mom doesn't even hit on me. So, it's kind of a shame.
Yeah?
Not really. A few minutes.
Okay, here we go.
Okay.
I don't know if Dr. Klein knows about the giveaway. We have an Amazon Alexa that we're giving away for all the expert shows. I don't know if he knows about that.
Oh, I'm well aware of it. Yeah.
Okay, perfect. Here you, Chris is gonna.
We'll let him give it away.
Gotcha.
Central Florida, and welcome into another edition of Stages of Life right here on WDBO 107.3 FM and AM 580. We are here for the next hour. Dr. David Klein is with us, and he'll be giving or medical advice for you, any ailments that you may be having. Maybe you woke up and just had a weird pain, or just, something just wasn't feeling right. Those mornings you just wake up and right away, like, ooh, something doesn't feel right. Well, then I'm glad it happened to you today, because you're able to call Dr. David Klein right now at 844-580-WDBO. That's the number right there, 844-580-WDBO. Those phone lines are open now, and we are live, so go ahead, get your calls lined up right now. 844-580-WDBO. That's 844-580-9326 on the dial pad. My name is Chris Crawford. Here's the man who's going to be answering all those questions for you, Dr. David Klein. Doc, how you doing today?
I am doing well. Feeling good. It's a great weekend here in Florida. It's not so great up in the Northeast where they're getting lots and lots of rain. However, we got our fair share last year. So what I wanted to chat about wasn't so much about how well I'm feeling, which, by the way, is great, okay? What I'd like to chat about is something that's been in the news. A lot of people are taking heat. A lot of people are giving heat unnecessarily, and it's strategies about returning to work and strategies how to return to school. And the two are intertwined, okay? Because quite frankly, we have a large number of people in this country that can't go back to work as long as their kids are out of school. And so this has become politicized, because if you shut the schools down, the parents can't go back to work, the economy takes a tank, okay? And then people believe, well, some people anyway, that the president's going to take responsibility for that, when in fact it really has more to do with a virus particle than it does to any particular political party. But remember this. Okay, in the pediatric population, so everything that's going to follow this, in the pediatric population, the total number of children that died with COVID was 1/5 of the number of the kids that died of influenza. Yet we never shut the schools down for flu. We didn't even shut them down for polio. So shutting schools down does not sound like a really American idea to me. So we're going to shut them down, keep the parents from being able to earn a living, keep our economy tanked so that we might end up with a socialist president in November. And this is really, really wrong. Make the election about things that matter, like personalities. Make things that matter, like their good looks, okay? Or whether somebody knows what state they're in and who their wife is amongst two women in close proximity. So I think what we need to do is to focus on what does it take to get back to school, because that is the pivotal deal here. So you've got the love of your life, little Junior, okay? 10-year-old little Junior is going to be going back to school, okay? Now, what are the miserable things that can happen to little Junior on his way to school, on his way home from school, or on the weekends at Boy Scout camp, right? Okay, there are lots of ways little Junior can take a hit, disease-wise, accident-wise, and in any number of other ways that are too numerous to mention. COVID is one of the most remote of all possibilities to make anybody ill of that age. And when they do, or if they do become ill, because I've tested now, I think 8,000 or 9,000 people, maybe a little bit more. We did 4,000 last week, okay? So it's probably a whole lot more. We've had one child test positive, all right, one. And I'll tell you, because I tested his whole family, they tested negative. So why this kid, the 6-year-old child tested positive, I don't have a clue, okay? That was one where, somebody mentioned a little earlier about my ego. I'll tell you what, I really ate that one, because I told the mom, the likelihood of your kid here, the 6-year-old, being positive is about 0. So why are we testing her? She insisted the kid was positive. I was like, darn it. I hate when I'm wrong. I really hate being wrong. Okay, but you learn from it. You learn from it. Okay, so what's it all about? And more so, what do you do about it? So you have a 6-year-old kid who would go back to school who's shedding virus, let's say. Okay, now that's a problem. The teachers, they get tested. Okay, so you know who's hot, you know who's not, you know who's immune, you know who isn't immune. The kids are a little bit more of a challenge to test because your options, let's just say, are a little bit more limited because of their age, and who the heck wants to hold down a screaming kid while you draw blood? Darn it. Yeah. I hate when I'm wrong. I really hate being wrong. Oh, yeah, they're reminding me of that. I love it. Chris, thank you for that.
That's some weird deja vu there.
You're a gentleman and scholar. No, actually, it might be the only time I ever hear that from anybody. It happened to be me. You got to love it. Yeah, how did we do that? We got. Oh, you did it. Oh. Here's my board operator here, my remote board operator.
I did it.
Yeah, she's not so bored, this one. So what do we do? Okay, so how do you get kids back to school? And why do you do this? And the answer is very simple, because if you don't, you're not going to be earning a living. So the trick to this business is testing. You test the kids for infectivity. You don't really care so much whether they have the antibodies. It matters later, but it really doesn't matter up front. So you want to know if the kid, your kid, their kid, anybody's kid, are infectious. So you just simply go ahead and take the block of children that are going to be returning in any particular district, bring them to school, bring them to the cafeteria, line them up, and test them for infectivity. And you can do that. And it's not necessarily what you think. And that's the beauty in all this. I'm going to start pretending I'm one of these financial shows, because I'm going to tell you can do it, but I'm not going to tell you how. Nah, I'll tell you how. Okay. So, I'm not going to be selling you an annuity either, just so you know. Okay, because that's what they do. So what are we going to do? We're going to go ahead and do what's called an antigen test. Now, an antigen test tells whoever reads it, whether or not the person that was tested is shedding virus. And that is wickedly important, because the PCR, which is the gold standard, really isn't much of a gold standard. It'll tell you whether or not you're shedding viral pieces. That doesn't mean that you're infectious. It just simply means that you have some portion of the active disease going on. So how do you get kids back to school? And the answer is with the antigen test. And so antigen is done very much the same way as the PCR is done. That's the molecular genetics test that we do. I guess we can do almost 900 an hour. Okay, which means we could do the county in about 2 days. So, but we can take care of this doing an antigen test. And you do a swab. And no, you don't stick it into anybody's brain. No, it doesn't really hurt very much, because you're sticking it in the anterior nose. This is where Junior sticks his finger. Okay, so if Junior can stick his finger in there, I don't think a little swab is going to bother anybody very much. And they don't scream very long, because they realize that it's just where their finger goes anyway. And you go ahead and take a little bit of mucus there, and you run it, and it takes 11 minutes to get the result. Okay, and that's the funny part about this, 11 whole minutes. So how would you get a school district back to work, back to school? And it's the same way we're going to do the RNC in Jacksonville. And you deploy the machinery, the technicians, you go ahead and get everything you need to do. The real secret is what happens behind the curtain, because all of these machines have to talk to each other. That's the fun part. That's where I take my IT department and challenge them. And then after 11 minutes, the thing takes 60 seconds. Actually, it's less, 15, 20 seconds. But if they're slow, like some of our employees, then it'll take a whole minute, and you get a result. You can tell little Junior he's free. Go. You can go to school. And then you knock him down. It's all done. And you do this, in my recommendation, every other week. And then you keep track of who's got a fever and who doesn't. And you don't do it with those stupid hands-off thermometers. And here's why. You can't really tell somebody's temperature if they're febrile, that's the doctor word for feverish, unless you actually take the temperature. And arguably, of the 3 typical ways that we do this, okay, orally, stick it under your tongue, rectally, you know where that goes, or stick it in somebody's ear. The 4th way is something that nobody really does with any degree of precision, and that's those skin liquid crystal things. You used to see those things around in hospitals, but they didn't work then and they don't work now. And now we have these hands-off thermometers that always read, wouldn't you know, 2 degrees too low. So what's a fever? 101. So what do? They read 99. So that the person, the licensed or maybe not licensed professional holding it thinks, well, you don't hit you're not febrile, because febrile is 101. It's only 101 if you take a rectal thermometer. Okay, it's 100.5 if you go orally, or temperament, the TM joint, that's the ear. So these things, they've got it exactly upside down and backwards, which is why they can't pick up somebody who's sick at an airport without looking at him and go, my God, the guy's sweating. He's about ready to pass out and he's clammy. That person might have a fever. No kidding. That person's about ready to die. Now, 95% of people that are infected with COVID, you wouldn't even know they had it. No fever, no chills. They might have a little headache, but you know something? Headaches are fairly common. They might have a little nausea. Nausea is fairly common, especially when you're traveling. So what happens is that it gets hidden amongst the noise. So how do you protect yourself when you travel? And the answer is very, very simple. You can't. All right? You can figure out whether you're going to get sick on the trip, okay? So these are the sorts of things that you need to be able to consider when you're going about your business. So what are the different types of platforms that you can do to test for COVID? Now, this is fun, actually. If you listen to the CDC, they're going to talk all around you because most of them really don't even know, if the truth be told. All right. Or you're going to listen to competing networks, where you'll get somebody up there who, again, is tapped to deal with shooters, and they're going to be tapped, to deal with any number of different issues. But this is actually fairly narrow, a bit of infectious disease, right? So here's the scoop. You can check for the DNA. It's actually RNA in this case. Okay, but many of the things we check for is DNA. It doesn't really matter. Deoxyribonucleic acid, or it doesn't matter. But what you can do is you're looking for viral particles. The machine that we have in Jacksonville, which we will talk about in a moment, is probably one of the fastest and most sensitive in the country. So I will turn this over to our advertisers while I sit back and have some hot water before I get into it.
All right. And we'll get those phone lines filled up too. 844-580-WDBO. Go ahead, give us a call right now. Those phone lines are open. 844-580-WDBO. You can give us a call right now. And stay tuned. We have another Alexa giveaway coming in the show in this hour. Stay tuned. You don't want to miss that. You're listening to Stages of Life right here on WDBO 107.3 FM at AM 580.
Now, for our Facebook listeners, okay, one of my most favorite things to do is to have the listeners on the radio get close to the radio and bring their Alexa in. Bring it in close to the radio. And then I announce, I want to buy an annuity. And then, I'd like to buy a Ford. Okay, and that blows up their phone. Because Alexa, she may be free. Okay, she may be inexpensive, but she's listening. And what happens is you are now going to get all kinds of email. That is a dirty trick.
That was a dirty trick.
Gosh, I love dirty tricks like that sometimes.
We got some people, we've got a bunch of folks watching us on Facebook.
Cool.
Thanks for joining us.
Yeah, thank you so very much, guys.
Appreciate that. Yeah. Dr. Klein, wondering about your dear announcer, Rob. Hope he's doing well.
Rob is actually, Rob is the cat with 9 lives. Okay.
And 9 toes.
9 lows. He only has 9. Yeah, that's a problem for him right now. So he's a couple short of the Hemingway ones down in the Keys. Forget my drift. So Rob is doing much better. He cut his foot rather substantially and ended up with the loss of a digit. Okay, but in the process of doing so, he ended up in these nursing homes, and he survived them. Okay, so he's bouncing back. He's actually heading home tomorrow, is my understanding. Mm-hmm. So he's doing well. He's a good dude. Now, whether he'll be back on the air anytime soon, it's hard to know because you still have to walk. Okay?
Yeah, recuperation.
So recuperation time. is
I saw the foot. It's going to be a while.
It is. Yeah. Well. Okay. So when I got the picture of that on my telephone, what did I do? I sent the meat wagon out to his house.
Yeah. Well, no, I'm talking now.
Now it looks great compared to what it did.
Not then. It looked like something that Rocky been working on in the back room at the,
No, it looked like
the meat hanging plant.
Yeah, it was the sort of thing you would have expected on a Civil War battlefield. And so he has done. Thank you for asking, because he's a good guy, truly a good guy. But like so many people, okay, he, something goes wrong, you deny it. I'm going to look the other way. It's going to go away. You can't do that. Okay, this is more typical of guys than women. All right, sure. Women, something goes sideways, man, they come in the office. Guys, they got a problem. Okay, it's a control issue, I think. That or ignorance. I'm not certain. You'd have to help me with that. If anybody out there has a solution to that one, that would help me tremendously. So what we're going to talk about, okay, are momentarily we're going to talk about the different types of testing procedures and what you need to know about them, because most of the people that you're going to hear this from really haven't got it right. Okay, they don't understand what they're talking about, and if I do my job right, you're going to know more than they do. You do that, you're good to go. It doesn't mean you're going to get anything for it, but what the hell, you might get a free Alexa.
Dave Levitt's trying to figure out how he's hearing me. You're not hearing me on DBO. He says, I'm watching David Klein and hearing you.
Dave Levitt with Refresh Computers. Now, he is a good dude, okay? So I've known Dave for a long time. I know his family really, really well. And if he's a funny guy. So he's got all kinds of opinions. Okay, I agree with many of them, not all of them. Doesn't matter. He's still my friend. But man, he is a hoot in a crowd because he'll pick a fight with just about anybody just for the pleasure of doing it. He reminds me an awful lot of my parents.
Well, he's listening to you now, so don't say anything
Oh,
bad.
I won't say anything bad about you, Dave. No, but Refresh Computers, I've bought many a product from them. They are good people.
I love they're right down the street from
honest
us.
people, okay? You know, and they price everything right.
And they know their stuff.
They know their business.
Speaking of knowing their stuff, I don't know if we have time to, but Dealey wants to know about Hashimoto's. Explain, please.
You want to know about Hashimoto's. Okay, I have Hashimoto's. Wouldn't you know it? Hashimoto's is autoimmune thyroid disease. And so what happens is your body develops antibodies, most typically, okay, to an enzyme called 3,3,5 prime deiodinase. He will not be tested on this. But it's the converting enzyme for T4 to T3. Key concept. That's the enzyme that converts synthroid to cytomel, or T4 to T3. Inactive hormone, prohormone, to active hormone. And then we can pick this up after we come back from the show. Hard to know, isn't it? You were trying to figure out.
Back in the studio.
We need to learn the clock. There's what that is, but we'll have opportunity to develop our own clock.
Dave said he loves you too.
Dave is a good dude. I won't just don't make sure nobody tells him. So
Okay, looks like it should be time. Let's see. Oh yeah, Melissa says she was just there at last week.
at Refresh, yeah, good. Yeah, it's just an interesting place. You know, it's kind of like if you ever watched that Big Bang Theory. Okay,
Oh,
you
yeah,
know,
they're-
yeah, you're walking into it. Just so you know, but there are no pretty girls there, unless you happen to be pretty, because you'd be bringing
the one?
you'd be bringing it. You know what I mean? Yeah. So you know, if you want to tip these guys, bring them comic books. You get my drift. You know, I mean, so they're good. They're good people, though.
Comic books place is like right across the street.
We think that's
up
a
the way.
coincidence?
You know, I know it's not a
It's
coincidence.
not a coincidence. No, I mean, you know, it's just kind of like anything else. You know, yeah.
Look
It's,
for the Spice Shop. They're very
Yeah.
nice in there too.
yeah, you're not going to find a lingerie shop that you won't find.
Welcome back to Stages of Life on WDBO 107.3
turn.
FM and AM 580. The number to talk to Dr. David Klein right now is 844-580-WDBO. Go ahead, give us a call right now. We are live and we're taking your calls. 844-580-WDBO. Doc, we've got 3 callers on the line, so we can go to the phones or we can talk a little about what's going on, what you got going on.
Let me take 2 minutes, then we're going to start on the callers. Okay, so what I want, because I gave the teaser. If I don't answer it,
Yes,
my
I
God,
know.
then I turn
You
into
did.
turn into
That's
a bad
improper
dude.
radio.
Yeah, bad news, bad protocol. Okay, so the different platforms are such. Okay, the PCR, which is molecular genetics, that's the one you all know about. Those are the ones that typically they go at the stand in line. You get it for free. They shove this thing up your nose, usually improperly, by the way, and then you wait 2 weeks to get the result. That turns into 3 weeks or 4 weeks, and by that point, it's irrelevant, right? But it didn't cost anything but 5 hours of your time in a hot car. That's number one. Number two is an antibody test. These can be the little finger sticks, or it can be done through a blood draw. These are the resulting. The results come back very quickly, but they don't tell you very much. They may tell you that you have an active infection, but typically they tell you that you've been exposed in the past. Not all that useful information, except for planning purposes. Third one is antigen. This is the most interesting one. And it tells you whether you're infectious now. Those are the 3. The real deal here is that you need to have somebody that knows what they're doing order the right test, or you're going to end up with the wrong result. You have to know what you're doing. And it's not a matter of expense. It's a matter of picking the right garment for the right weather conditions. So we do all 3 of them on 5 different platforms, which means that if one goes down, we have backup. But more so, each of the different platforms has different advantages and disadvantages. And we'll get to that in specific detail after we start taking some callers and making some people feel better. So let's go ahead with the first caller. What do we got?
Oh, wow, a double tease from Doc today. I like it. We're going to start with Debbie. She's calling in from Oak Hill. Debbie, you're the leadoff hitter. What is your question for Dr. David Klein?
Are you there? I think I put her to sleep. I must have lulled her to sleep. Okay, why don't you go ahead and leave her on the line there? But let's bring caller number 2. I'm going to pretend.
Yeah,
that
we'll go
I'm-
to Bithlow and Lou, and we'll try and track down.
Yeah, I'm gonna
Debbie.
do a Sean
Lou,
Hannity here.
you are now the leadoff hitter. What is your question for Dr. David Klein?
You're super or hyperfolate.
Yes.
Okay, I'm a patient of yours.
Yeah,
but-
you're down in the Keys. I recognize your voice, Lou.
Yeah. Okay.
What you
went
got?
to the heart doctor. They did all the tests. Did the angioplastic, the whole 9 yards.
Good.
My stent It was put in 17 years ago. Blocked
Uh-huh.
up. They say 100%, but according to the pictures, it looks like it's still got a little bit of an opening in it. Okay,
right.
I'm still getting some passage through there. They said my left side of my heart now is feeding my right side of the heart. Said that it grew veins over to. Well, I know that without the right coronary artery, you're not going to be doing real good, and that's where I'm at right now.
All right.
So I got the hyperfolate. I was listening to you on one of the programs about unblocking your arteries.
Yep.
I started taking that 2 weeks ago, and I took double dosage for the first 5 days.
Okay.
2 a day. Should I stay on that, or should I go to just 1 a day?
No, okay. Okay, what Lou is doing is he's taking a high-dose folic acid. We call the product hyperfolate. It's 5,000 micrograms of folic acid. This is 12 to 13 times the RDA. But what this does, folic acid is vitamin B9. What it does in high concentrations or high intake is it increases collateralizations of the arteries. So in other words, what you think, what you said about veins, feeding it from one side to the other, it's actually arterioles. It's the arterial side where this stuff works. And what it does is it opens them up and over time reverses plaquing in the arteries. Now that's not plaquing or clotting of a stent. That's a very different matter. Okay, so you can't really open a stent up with folic acid, but what you do is you open up the collateralization. So my dad, he passed away at the age of 92, had a complete obstruction of his left anterior descending artery. Okay, they call that the widowmaker. Completely gone. But he had full collateralization. He was on folic acid this way for 15 years. So he had no dyskinesis of the heart. That means the heart was beating perfectly fine. The guy could swim an hour. Lou, he could be out in the pool and do laps for an hour. Now, I can't tread water for 15 minutes without getting tired. My dad, who is 50 years older than me, okay, could do this thing, and it was just embarrassing as heck. Folic acid will open up the collaterals. So 5,000 really is about all you really need. Doubling it up wouldn't have done, but it's not going to do any damage. There's no toxicity to it. So what you do is you stay on it. How long does it take to work? And the answer is between 6 and maybe 16 weeks before you can measure how things start to open up. But it will lower your cholesterol. So cholesterol will drop with high dose folic acid. So I use it in lieu of statins. So there are a bunch of things you can do with folic acid other than just simply save lives. You can go ahead and you can lower cholesterol, which doesn't necessarily save your life, but it sure as heck gets the internist out of it. So Lou, does that answer your question?
And they want to throw the statins at me, and I've had too many bad problems
No
with
kidding.
statins. I won't take them anymore.
Yeah, well, that was the whole reason we started.
The other thing is with my what do you call it, being real high.
Triglycerides?
Oh, gosh, the triglycerides. He
Yeah.
told me to start taking niacin, so I got that and started taking that.
Oh, that'll make you feel good and sick. Yeah, generally speaking, to bring triglycerides down without making people feel that sick, I use berberine, which I believe you're taking. Berberensis is an interesting herb, but it lowers triglycerides, lowers insulin levels, and lowers blood sugar. So it's like the trifecta. Reduces your risk of cancer, but it also helps with diabetes. Very, very interesting stuff. So Lou, I think we've got a commercial coming up. Is that correct? I see somebody
Yes,
throwing
sir.
fingers
So
at
really
me. I'm not sure. Usually when I'm driving, okay, that's I see that. I think that's like in some cultures, it's a sign of friendship.
I'm just glad to see they're continuing the tradition out of studio that we used to do in the studio.
Sure enough, bro.
844-580-WDBO. Go ahead, give us a call. 844-580-WDBO. You're listening to Stages of Life on 107.3 FM and AM 5.
Oh, fascinating this world we are living in.
This stuff really is fun.
It is.
It's the only place in my life, and I do mean this, the only place in my life where I get the last word.
Okay, let me give you.
It doesn't last long.
We've got a couple of people online now
All right,
on,
what do we got?
on our Facebook feed here. Let's see. Joseph says he wants to know, he's got a 28-year-old female, probably Ehlers-Danlos.
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 Ehlers-Danlos is an interesting problem. There are a number of different subtypes of Ehlers-Danlos. And so what's cool about Ehlers-Danlos is the texture of the skin. It feels doughy. And if you go ahead and take the palm of her hand. Now, you have a 28-year-old with Ehlers-Danlos.
Just saying,
Okay,
able to dislocate knee, shoulder, hip, just rolling over and sleep.
It's
Obviously
exactly
very
right.
painful. Any supplements we can use to strengthen joint tissue for this?
No, but what you have to be careful of eye dislocation, dislocating the lens. There are a lot of things you have to do. So you have to resist, and I have a number of patients with this, okay? Resist the temptation to crack fingers, okay, and to do stupid things. Okay, like playing basketball would be right up there. Okay, skiing would be right up there because it's very, very easy to destroy a joint. But more so, Ehlers-Danlos does damage to joints in this way. So if you had a door and you have a door jamb, the door closes, it bumps up against the door jamb. All right, that protects the hinges, it protects the door, and it protects the screws holding the hinges to the door and the door jamb. Right, but if you took the door jamb out and that door continued to open up, it would rip the hinges right off the wall. And that is how it causes damage to the joints, and it causes terrible pain. There's some things that you can do to control the pain, but the patients I've had with Ehlers-Danlos, I've done things like telling them to put knee braces on. Now, not the fancy ones with all the little bars, but just simply the tube ones, like they're tube socks. And what it does is it reminds you of the limitation. It's like tying a string around your finger. So the place that you're most likely to get damaged with this is actually the knees. The ankles to a lesser extent, the shoulders to an even smaller extent. So as long as she's careful about what she does and does not pretend that she's a contortionist, okay, which is the other thing. Can you take your hand and put it behind your back? Okay,
Yeah, probably should.
And they do this. That's, I've long since learned that when I've got a patient that I suspect with this problem, I don't ask them to do that, okay, because it's just wrong. But it's a genetic illness, and it's got variable penetration. It's just an interesting problem.
Julie's checked in. She said, love listening to your shows. Appreciate your cut-to-the-real story and guidance on COVID.
Cool. Well, thank you. Just wait, because pretty soon I'm going to have one of these weblog feeds, okay, and I'm going to have all of the COVID stuff that I've done in the past all up there to be seen.
Call them podcasts.
Podcasts. I can't remember what they're called.
It's okay. We'll make sure that
We
they
did
know.
them with our camera and sat in the office and started broadcasting during my office
Gina
hours.
says her pen doesn't work. What's the dosage for folic acid?
Folic acid. The dosage is 5,000 micrograms.
Yep.
The typical ones you're going to
Thanks,
find
Ian.
at the store are 400 or 800. These are 5,000s. So the cheapest way to get it is to go on stagesoflifevitamins.com and look up Hyper, Hyper. Think about your kid, okay? Hyperfolate, right? And so it's $4 a month. It's a whole lot cheaper than going ahead and cobbling it together at the GNC.
Right. They want to know if there's an after-hours number for Stages of Life.
Well, there's not an after-hours number, but I'll be happy to give you the number where you can reach us. And if you have a COVID issue, we have one of those as well. So for Stages of Life during the week, okay, it would be 407 679 3337. Okay. And for the COVID stuff, if you've got some issue there, we can actually do testing on the weekends. So we have what we lovingly refer to as the COVID hotline. And I'm going to see if I can find this for you if I don't fat finger my phone, which has been an issue with me. There we go. So the COVID line is 407. I'm now calling it by mistake. It's 407-636-3945. That's 407-636-3945. And it rings to 2 or 3 different people. They'll answer the phone, or you leave a message, however it works out, and we can arrange to get people tested on the weekends as well. Okay, and that's kind of a big deal these days because I've got to travel on Monday, I've got to go here, I've got to go there, I need surgery on Monday, I need a COVID. We can actually do it and get it resulted quickly. It may mean you have to drive to one of our drawing stations, okay, but that's neither here nor there. So I hope that gave you the information you needed. But no, there's nobody there listening to the phone on the weekends. Are you kidding?
How do you control blood pressure in the morning? Clonidine?
Clonidine works beautifully for that. Generally, when I'm treating blood pressure issues with medications, I'll use amlodipine in the morning and lisinopril or something similar at night.
She's using a morning and night.
For amlodipine?
No, the one you just...
Lisinopril? Lisinopril doesn't work that way.
Clonidine.
Clonidine is a great medication, by the way. It's one of my favorites. And going BID or twice a day is exactly appropriate. But if you find that you have breakthrough with it, you may be a candidate to either go to 3 per day or to use the patch. and you put a patch on once a week. This is the only one that I know of that's a once a week long patch. It's a whole lot more expensive than the pills. So I generally, because I'm a cheap guy, I don't like spending other people's money, so I usually use the pills. But there are folks that really need the patches. And if that's the case, you can get, you put one patch on a week, the pharmacy dispenses 4 in a box, and you're good to go.
How long before we come back there, boss? I guess after this.
We're going to wing it. That's half the fun with live radio. You don't really know what you're going to get.
You guys are welcome. Thanks so much for checking in on the Facebook feed.
I need to get back to that gal in the Hashimoto's, too, because I wanted to explain a little more to her.
Yeah.
CC said he's going to open up here with the giveaway, and then you don't have to worry about it. He won't take that caller on air.
That's nice.
Okay.
We're back.
Hey, welcome back to Stages of Life right here on WDBO 107.3 FM and AM 580. Do you know what time it is? Yes, it's time for our Alexa giveaway. Yes, let's go. 844-580-WDBO. We are giving away a free Amazon Alexa during our Ask the Experts weekend programming this whole entire weekend. This is your second to last chance to win, I believe. So go ahead and give us a call right now. Caller number 10 will win a free Amazon Alexa so you can listen to WDBO, in your kitchen, in the living room, wherever you want to take it in your house, you'll be able to. 844-580-WDBO, 844-580-WDBO. That is the number to call in. Caller number 10 is who we will take right now. In the meantime, Dr. David Klein is still here with us. And Doc, should we head back to the phone lines here?
Yeah, okay. What have we got there?
Well, I think we tracked down Debbie. So we're going to go to Debbie. She's calling in from Oak Hill.
Cool.
Debbie, welcome to the show. What's your question for Dr. Klein?
Hi, how are you today?
Well, Debbie, it's good to have you here. What's up?
You too. I'm glad you're there. Thank you. I appreciate it. I have hip dysplasia.
Okay.
And I already had my left hip done. And then, recently, my right hip has started to go. So I'm wondering, is there anything that I could do to stave off surgery?
It's hard. Okay, here's the real deal with hip dysplasia. Okay, so you'll end up with arthritis. Things will start to go sideways, and then the hips can either fracture, which is sort of a bad thing, or they can become dislocated. So you go and do a total hip replacement. You want to do these when you're at your absolute healthiest. So as a general rule, if you know that you're going on for surgery, you don't want to postpone it as long, too far, because if you're healthy with age on you, it's only going to go south. So get it done when you can. Now, what can you do to improve your recovery? This is where it gets interesting. What I'm going to recommend that you do is to assume something, okay, which is a good bet. It's a strong bet that you have osteoporosis. So osteoporosis actually makes the surgery a little bit dicier. So what you'd want to do is harden the bone. And they're going to say, well, you can use Boniva or Fosamax. That doesn't harden the bone. It just simply slows down the degradatory process. So the way you harden the bone, okay, and it takes between 6 to 16 weeks before you can measure it, but then you can just continue with it, is chelated strontium. Strontium citrate will harden the bone. You take it with vitamin K2, vitamin D3. So strontium, K2, and D3, the combination is very, very strong, will strengthen your bone. And if you noticed, I didn't say anything about calcium because they've already got you on calcium. And they're going to think that calcium's the problem. It isn't. It's a strontium deficiency that causes the osteoporosis. So if you can harden the bone in preparation of the surgery will go better. It's going to heal a whole lot faster, and you're going to be a whole lot happier because nothing is worse than trying to drill into wet drywall, which is what it feels like when you're working with osteoporosis. So you want to harden the bone to the extent that you can before the procedure. So does that make sense to you, or did I talk too fast?
No, it does. It totally does. It totally does.
All righty. Well, if you have any questions about that, give me a call because I can walk you through it. It's actually a very, very simple thing to do. Again, if you go on stagesoflifevitamins.com, and then go to the top and type in strontium. There'll be a whole lot of these 10 to 15-minute lectures that I've done on this. And all you have to do is listen to them. They're not sales pitches. You can get our stuff if you want to. That's nice. If you get somebody else's, that's not as nice. It doesn't matter. But I want you educated on this. That's K2, D3, and strontium in the dosages that I recommend in those little lectures. So, Debbie, thank you very much for calling. It is really a pleasure to speak with you. what's next.
Thank you.
Thanks so
to do
much,
it.
Debbie. Appreciate you joining us here. Let's continue right along here, Doc. We've got Carol calling in from Winter Park. Carol,
Cool.
welcome to the show.
Okay.
What's your question for Dr. David Klein?
Hi, Dr. Klein. Listen, I've been listening to you for a long time, and you've helped me so much.
Well,
but
thank you.
In 1961, we got married in Pittsburgh, PA, and
You and I?
came to Melbourne, Florida.
We got married. I don't remember, Carol.
And guess what?
What you got? I'm sorry.
Our dear friends over there had 5 kids, and their little 5-year-old daughter got polio, and they put her in a ventilator, and guess what? She died. And nobody else in the family got sick.
Yes. Okay. Okay. So that was just about the time when I got the polio vaccine. Okay. I was born in 1954. When I was in elementary school, we lined up around the block to get those inoculations, kicking and screaming, but we did it. And there was nothing you could do. If it hit the bulbar motor neurons, you couldn't breathe. That was the end of you. There's no coming off those iron lungs is what they called them. Okay, iron lungs now are called ventilators. The difference is that one uses vacuum, the other one uses positive pressure. Does it matter? To me it did, because that's what I did for a living. So why didn't other people in the family get sick? And it's the same reason why President Roosevelt got sick, yet Eleanor did not. It's because we have different levels of immunity. Polio is a disease of developed countries. That means in Western countries, because we have great sewage treatment here. It's a fecal oral kind of a deal. And where do you pick up polio? You pick it up in the water supply that's been contaminated. So it actually takes a contaminated bit of water to give somebody polio. It's an interesting problem. So why didn't the others get it? Because they probably had either lesser of an exposure to it or a better cellular immunity. And so they can count their blessings. It's a shame when one member of your family dies. But I remember when I was in school, we would go to school and there'd be an empty desk. So it's kind of like, where did little Betty go? Well, we can't really talk about that now. Where did little Johnny go? We'd really rather not talk about that. And they never came back. So I'm sorry to hear that. But what was your question about the polio? Was it why do some people get it and some don't? And the answer would be,
well, I just wanted to say that Dr. Jonas Salk invented that wonderful vaccine, so it is possible that we could have one for this virus too.
Carol, we're going to have one because it already exists for cattle. Okay, they had to go and do the polio one by from scratch, but there's already a vaccine for coronavirus. We use it all the time in cattle. So it's just now a matter of adapting it to human use. So you're going to see it before my prediction is you're going to see it before the beginning of the year. And, does that make a big difference? But I'll tell you what, Carol, what you need to do. Okay, and it's what I do. And I prevent coronavirus in myself and my family and the people that are willing to listen to me. And I do it the same way that it's done in nature. So cattle, they'll deliver a calf into the grass. Okay, that is not a sterile environment. Not by a long shot. There's poop all over the place, all kinds of worse things than that. And so the calf is going to become exposed to these pathogens at T0. That's the moment they're born. So what do? They're given something called colostrum in the milk of the cow. And it's rich in gamma globulin. So I have my staff taking it, I have my patients taking it, and I'm going to recommend that you do it. The lactoferrin-containing colostrum is the way that cattle protect themselves in nature. So if you emulate it, wouldn't you know it, it seems to work. So if you go on stagesoflifevitamins.com, type in colostrum, it'll show it to you. The dosage that I've found to be effective is 2 at bedtime. So a bottle, I think, costs $38 and it lasts 2 months. So for $19 a month, it reduces your risk of getting sick. So that's what I would suggest that you consider doing for coronavirus. And we are going to have an inoculation sometime in November, December. So despair not. I think we've got it coming. What's next, my friend?
Call Carol. We're going to go to Lady Lake. We've got Linda calling in. Linda from Lady Lake. A lot of alliteration. Welcome on the show. What's your question for Doc?
Hello.
Hey, how are you doing?
Hello.
You're on the air, babe.
Hi, good. How are you?
Well,
I have a question. What would you recommend for a non-diabetic idiopathic small fiber neuropathy, probably caused by a sports injury?
what type of sports injury was it?
Golf.
Okay. Now, is it just one small area, or is it in broader strokes? In other words, you have both hands, both feet?
No, hands and feet.
It's not coming from golf. Okay, that wouldn't do it.
Well, I think when I hit the ground.
I don't care. Okay, it doesn't matter. When you see that pattern, okay, you learn to do medicine by patterns. Okay, if you sit back and look at an X-ray up close, you'll miss pathology every time. If you look at blood work by looking at one line at a time, you miss things all the time. But if you step back and look at a pattern, you stand a chance of figuring it out. When you see hands and feet like that, it's going to be one of two things. It's either going to be a B12 deficiency, okay, which is the least likely of the two, or something called hypothyroidism. When your thyroid is inadequate, and there are lots of ways this can happen, and it's not a simple blood test to do this, you'll see entrapment, something called carpal tunnel bilaterally, and you'll see tarsal tunnel bilaterally. With diabetes, you'll also see one called sural neuropathy with it. So when we do sensory nerve conduction studies, it gives you the data you need to be able to sort this out. But more than likely, what you've got going on here is little more than hypothyroidism. And one of the things you can do is take your temperature. I mean, not the way that's done with these touch-off type deals, which you've heard me just rage about. Okay, you do a regular temperature, and if your temperature is usually cold, or you rarely ever get fevers, or if a fever for you is 98 degrees, you are hypothyroid. When this happens, the nerve will swell against a tight exit. So I want you to imagine that you have a ring on, your wedding ring, okay, and then you break your finger. The finger's going to swell, but the ring does not. When you develop hypothyroidism, the nerves that are passing through these canals swell ever so slightly, but the canal itself does not. Now, can you develop carpal tunnel from golf? And the answer is yes, but it's never bilateral. It's almost always on your non-dominant hand. So if you're right-handed, you'll see carpal tunnel on the left side. If you're right-handed, so this is pretty much the way these things go. But it's an asymmetric entrapment neuropathy with golf, not symmetric. So I would disagree with you. So get evaluated properly for thyroid disease. That includes production, destruction, autoimmune disorders, and functional hypothyroidism. There are 4 ways you can make this sick easily enough. So, Linda, does that help you at all?
Okay, so try to get evaluated for hypothyroidism.
And do it properly. So you need T3, T4, TSH. That's something that they usually do. But you also need to have something called TPA and ATG. These are the autoimmune titers. Then you have to start looking at things like estradiol, because if your estradiol is too low, the TSH is not even readable, because you have to have adequate estradiol for the TSH to go up. And that's where most people get missed. That's where things get screwy, because they'll check your thyroid, but they forget the fact that there are other hormones that influence thyroid consumption as well as production. So you need progesterone, testosterone, and estradiol as well. Those are the studies you need to get in order to properly evaluate for this. And this is something we do.
Thank you very much.
Yeah, we do this all day long at Stages. This is like, this is what they call a fat ball over the plate. Okay, this is an easy one for us because we see these all the time. We get them from all over the country. So give that a try, Linda, and if you have any problems, let me know and I'll walk you through it. So what else we got, Chris?
That will do it for right now. We got to take a quick break, hit the 3 big things you need to know, but we can still take another caller, 844-580-WDBO. Go ahead, give us a call right now. Last segment coming up, 844-580.
Oh, boy. We may be out of questions at this point.
You get to see my bald head.
Whoa! Yay! I like your head. All right, let's see what we got here.
It's actually not really all that bald. There's more hair than there would appear. But, I wish there were more.
Really? Oh, we got a new message.
It's a good thing my wife likes bald men. I mean, she's actually, chases them.
Keep convincing
She has
yourself of that.
She has a long history of
Facebook's got a question.
Bald-headed, arrogant men.
What is the proper time for a blood draw if you have Hashimoto's?
Best time to get it's in the morning. Okay, so 0800 is best. But does it really matter? And the answer is no. Okay, because it's after seeing lots of these, it really doesn't make as much difference, except for the cortisol level. So cortisol also is terribly important when you're dealing with Hashimoto thyroiditis. Why? Because if cortisol level is too low, okay, which is the body's natural anti-inflammatory, you're not going to get adequate control of the thyroid. So this is the sort of thing that is, again, wickedly important. It's not amateur hour when you're trying to treat this, nor diagnose it. Best time to get the lab work is 0800, as best you can. I hope that answers that question. What else we got there?
Let's see. Well, you were going to explain Hashimoto's a little
Yeah,
bit
okay,
more.
Hashimoto's. Okay, so Hashimoto's is autoimmune thyroid disease. And so this differs from, my thyroid's not working, my TSH goes up. Okay, fine. Any clown can figure that one out. All right. Let's say that you've got yourself an autoimmune disease, kind of like fibrositis or kind of like ulcerative colitis and many of these others. You have developed antibodies to certain tissues within the body. With Hashimoto's, you develop antibodies that are called ATG or TPA, antithyroglobulin or thyroid peroxidase antibody. And so you'll either be allergic, quote unquote, it's not really an allergy, it's an autoimmune issue, to the transport protein or the converting enzyme. Consequence is that you can't convert T4 to T3. And the lab studies, if you don't get TP and ATG, are entirely misleading because they can be perfectly normal. It's very much like if you have a pocket full of keys, you have a key ring, okay, and you can determine a normal key ring by the weight of the key ring. And then you go ahead and bend the keys. If you bend the keys, they don't work, but it weighs enough. So how can you be hypothyroid? Because all of your keys weigh the same. However, if they're bent, which means they have the antibody attached to them, or if they're misshapen, then they don't work. So there's another one called reverse T3 syndrome, which is actually fairly unusual. It does happen, but not often enough to really mention here. So how do you prevent Hashimoto's? You prevent it by taking enough zinc and selenium in your diet. Zinc and selenium deficiency lead to Hashimoto's over time. And part of the treatment that I do, in addition to replacing the thyroid hormone, okay, and then shutting down your own production because I want to reduce the antigen level, thereby making the body produce less antibodies. But you always give zinc and selenium in appropriate dosage and ratio. The stuff that I use is called Magic Minerals. It's easy and it's cheap. Honest to God, it takes nothing. Go on stagesoflifevitamins.com, look up Magic, M-A-G-I-C. And up will come Magic Minerals, and then go down to the audio files and start listening to things about thyroid disease. I think that's probably going to answer your question better than I can right here. Why? Because you got at least 2 hours worth of listening right there in front of you. So
you're saying low temperature and high BP, right?
Yeah, low temperature typically, but blood pressure is variable. It usually creeps up and it has to get treated, but that's over 10 years. So you'll end up seeing that later on. That's when the vasculature starts to get weird. So early on, you may not see blood pressure issues. You will see a low pulse, you'll see a low temperature, and cholesterol goes up. Hypothyroidism, cholesterol goes up. So what do? Back in the day, and I mean long before I was a physician, they didn't have the capability of looking at thyroid hormone assays. So how did they know whether you're thyroid or not? Hypothyroid? They felt, you've got a goiter. That's one good indicator. Your temperature's low, another good indicator. And the third one was cholesterol levels. If your cholesterol went up and you had the other two, you were hypothyroid and you got treated.
1 minute. Maria said, Dr. Klein, you are my favorite doctor.
Well, thank you, my
that's
baby.
sweet. By the way, I just want to say congratulations to the new grandparents.
Yeah, we got 2 new ankle
Graham
biters.
and Henry, huh?
Yeah.
Wow, that's fancy names they're going to have to grow into.
Yeah, no kidding. Yeah, they're going to get picked on. Yeah, we call one Ace, the other one Deuce. So that's going to be their nicknames. They don't know it yet.
They have no idea, and I'm thinking they as the children who had the children don't know
Yeah.
what you're talking about.
Yeah, here comes Ace, here comes Deuce. Who do you think is going to get the big piece of pie at the Thanksgiving, right? Yeah, they're going to do well, the whole lot of them. Yeah, it'll be fun. But we will create some, so Tessa's mom called the second one, Graham, Ditto.
Oh, no.
Because he looks an awful lot like...
First one?
No, looks awful like his daddy.
Oh, okay.
Yeah, so she says, looks an awful lot like Justin. We'll call him Ditto.
Here we go.
Very strange sense of humor.
Welcome back to the Stages of Life on 107.3 FM and AM 580. We're on the Stages of Life office located at 1917 Booth Circle. Their phone number to call for an appointment, 407-679-3337. Again, the office number, 407-679-3337. You can always check out their website, suffernomore.com. You can download their new 24/7 radio apps. You can listen to Doc whenever you want. Hugh, our winner of the Alexa can listen to Doc whenever he wants and on the Alexa. That's pretty sweet right there. And, of course, stagesoflifevitamins.com as well. Let's go to the phone lines here, Doc. We got a caller calling in from Winter Park. Mary is on the line. Welcome on the show, Mary. What's your question for Dr. David Klein?
Hi, Dr. Klein.
Hi, Mary.
I've recently been getting some checkups at the heart doctor for my heart, just to go over an overall checkup.
Okay.
And my they tested me for lipoprotein little a,
Yeah, okay, lipo A,
which
sure.
they said is hereditary, and I do have it. And my levels in November were 264, and now they've gone up to 290 8 months later. My LDL is 155. My triglycerides are 59. My HDL is 88.
What's your
So
total
they're putting me
cholesterol?
on a 5 milligrams of Crestor.
Yeah, okay. What's your total cholesterol doing?
Total cholesterol is 259.
Okay, so functionally, what you want to do is you want to get the total amount down under 200 to 210. They'll say it's 200, but really, women have a higher cholesterol than men do. As statistically, that's the way it kind of works. So yeah, you're going to want to bring it down. But with your triglycerides in the 50s, okay, taking Crestor makes no sense.
59.
69.
Yeah.
It's okay. Crestor is
59.
Okay. The principal advantage to rosuvastatin, which is the drug, okay, is that it lowers triglycerides. Your triglycerides are already as low as you want them to be. If you want to bring down the other, okay, really what you want to be doing is you want to be using N-acetylcysteine and high-dose folic acid. And that will bring down the total cholesterol very, very easily. And when you add something called silymarin to it, milk thistle, you excrete the cholesterol in its entirety. That's the fastest way to bring it all down without using a statin. But I'm not sure I understand why they chose rosuvastatin, because the triglycerides have a double-edged sword attached to them. If they're too high, it increases your risk of cardiac issues, and if they're too low, you end up with blood sugar type symptoms, things that are unstable. So you don't want your triglycerides to drop too low. And at 59, my target is 75 to 85. That's where people tend to feel the best. So you're already below that. So I'm not so sure that I agree with the choice. But getting your total cholesterol down is easily done. N-acetylcysteine, the dosage is 500 milligrams 3 times a day. Folic acid, 5,000 micrograms. That's the hyperfolate, which is 1 capsule per day. And silymarin, which is 150 milligrams, and you would do that twice a day. That will probably bring your cholesterol down under 200. And that might be all you really need to do. So I would give that a try. If they're giving you low-dose rosuvastatin, 5 milligrams of rosuvastatin, that's not enough to do anything anyway. All right, so it'd make them happy, take it, but I would go on the others and actually get the job done. Does that make sense,
Do you
Mary?
know anything about the lipoprotein A, though?
Oh, I know a lot about it. Okay, what I will tell you is that there's really, yeah. Oh, I've heard of it
my
before.
level's 290. It worries me because they say, you could.
Yeah, I know.
It should be below 30.
Yeah, I got it. Okay, really what you need to be doing is getting the HDL up, okay, which you can do, and then get the total cholesterol down. Okay, and that's fine. But rosuvastatin isn't necessarily going to be the thing that's going to bring your ApoA. It's just not going to do it. But you can give it a try. But just listen to what I'm telling you. N-acetylcysteine, high-dose folic acid, silymarin, and you're going to watch your total cholesterol drop. They're still going to want to put you on a statin because they always do.
So they don't like it. They're going to try it for 6
I know.
months and see
They
why
always do.
not.
Okay, well, let me go ahead, and I need to give you some numbers, okay? And the after-hours Florida laboratory analysis, that's my laboratory up in Jacksonville, is 407-636-3945. That's 407-636-3945. So if you need COVID testing done in a hurry, this is where you go to do it. We have offices that can draw it here in Longwood. We can do it in Jacksonville and St. Augustine. If you can, get it done if you don't mind driving to us. Thank you very, very much for listening. It's been my pleasure. Stages of Life Medical Institute. This is Dr. David Klein, and it's back to my weekend.
Ask the Experts Weekend continues right along here.
Thanks, Doc. Have a good one.
My pleasure. You guys enjoy.
580 latest.
You too.
Thanks, everyone, for joining us on Facebook, and we hope you got the good answers that you were looking for.
Or some you didn't look for.
And maybe extra stuff that you weren't even planning on exactly. I'm going to go back and hit the pool. Looks like you're going to hit the bar. We're out. Okay.